Hello everybody, this is Dr. Kalpanasringar from Prakruthi Charitable Foundation. I welcome you back again to my channel, Tuning the Fragile Mind. I'm here today to talk about mood disorders. In the last episode, I spoke about thought disorder, and today I would like to briefly tell you how to identify mood disorders. In mood disorders, we have two main categories. One is mania and the other is depression. What are the causes of these things? Again, when we go back, it is the same thing. It could be genetic, it could be environmental, or it could be because of stress. These three factors are even there in thought disorder. But when you talk about mood disorders, especially the manic phase of a person, it could be genetic, and people with the genes could also be normal even though they have the gene for it. Because the environment is so congenial to them that whatever happens, they don't get an attack of mania. Even in depression, even if they have a history of mental illness in the family or depression in the family, it could pass on to generations, but in some cases, people can escape this when they're happy people. I've told you in my previous episodes that happiness is something that you cannot buy. It has to come from within. It should be intrinsic. So there are some people who are really happy and they do not have any problems because they're very, very contented with what they have. Even though this is a competitive world, and we come across so many people who are earning so much and buying all the latest gadgets and all that. There are some people who are really happy with the old gadgets. They're happy with what they have. They're very, very contented. So I wish everybody is like that, who are really contented with what they have. They will never have such episodes. I don't say that you should not buy anything that comes in the market which is new. Do it if you have the money for it. If you don't have it, forget about it. But this doesn't happen in many of the cases. People like to show that they have the latest equipment with them, the latest gadgets with them. This causes a lot of competition, and because of the competition, they lose their mind. Apart from this, I can show you a few pictures wherein the person is totally manic, wherein she's screaming her head off because she feels that nobody is listening to her and there's so many things that are bothering her. She could be having delusions, she could be having hallucinations, and she feels that, come on, let me scream my head off. She could even turn violent, she could beat up people, she could harm herself. Such people really need help. You need to take them to a mental health professional where they can be put on certain medicines which can control their anger, which can control their abusive behavior. See, it's very difficult to control these people when they have this sort of an attack. Even 10 people can't hold them down because you cannot even sense from where they're going to get so much of strength to beat up everybody who's around them. So in such cases, you have to take them to a hospital where they get good treatment and they come out of it. In this sort of a mood disorder, in manic depressive psychosis, which we also call as bipolar disorder, it could be seasonal. In winter, you could see many people coming with depression. In summer, you could see people coming with mania. So you have to be alert. You have to see that they are taking their medicines on time, and they have to be very, very punctual. They have to religiously take it. If they don't take medicines, they could, relapse frequently. And once they start relapsing like this, a person who'd get an episode once in 8 years could, get it once in 4 years. It could be reduced to 2 years. It could be reduced to 1 year. It could be reduced to 2 days, 1 day. So you have to be very, very careful in managing such people. A person who goes into mania can also go into depression. But when he's in this fit of mania, apart from being abusive and violent and all that, he could also have these what we call grandiose delusions, wherein he thinks that he can control the whole universe, he can control so many people, he's capable of doing so many things, he's capable of multitasking, and he can go through so many newspapers at the same time, he can go through so many magazines at the same time and imbibe whatever is there. They go into that phase wherein the speed of thought, increases. Instead of going slow and understanding things, they go in such speed that they feel that they have accumulated all the knowledge that is there. There's some people who become over-generous. They call everybody and say, come on, I have so much money and what do I do with it? Come on, let me distribute the money. I remember a very typical case which came to us long back. He was working in a company, a dairy development organization, and he used to stand there as soon as he would get his salary, and he used to call everybody and distribute his money. It used to happen every time, every month. Then once it so happened that his family, his wife and children had nothing to eat. When they asked him what happened to the salary that you got, he said, I gave it generously. I'm a generous man and I can earn so much. It was then that they got him to the hospital and he was hospitalized with us. Of course, he came out of it and we had to put in a lot of effort. And I gave you this instance because people can go into such frenzy of, distributing money or distributing whatever they have, gold or silver or anything. These people are really sick and they need help. Some people talk too much. There's no full stop or comma, it just goes on. We call it verbal diarrhea. They go on talking. There's no stop at all, there's no full stop at all. So such people, when you put them on medication, of course it takes about a few weeks to a few months, but then they come out of the problem. Now when these people come into a depressive stage, when they are on medication, the medication will be titrated, the medicines will be reduced, but you have to even think about their depression. You can't just neglect it. Because those moods in which they go into severe depression or stoop down into depression is going to be very, very severe at times, wherein they cannot think of anything, they cannot eat, they cannot sleep, they're not motivated to do anything. And imagine if these people are working in a place, they cannot retain their jobs also. Because of total lack of motivation, they don't want to do anything. They just want to sit back or sleep or try to sleep. In another case, you can see that these people start overeating, oversleeping, but they don't like to talk to anyone. They just sit in a corner of their room. They may try to do something, but they are not interested in anything. They don't show interest in any sort of thing. So such people, they have to be treated with medication, with psychotherapy. Some need rehabilitation. And once they go into this major depressive episode, it could be two extremes. In some cases, they overeat, oversleep. In the other case, they may not eat, they may not sleep. And you should be very careful when people are going through a major depressive episode, because they may also attempt suicide. This is the risk factor. And many a times, major depressive episodes are just neglected, because when they see a person who is manic, who goes into depression, they feel that, okay, he's calmed down. This must be his normal. No. You have to immediately approach your doctor and say that this chap is going through severe depression and probably he needs a change in medication. There's another thing, I don't know whether you have heard of this sort of a word called hypomania. Hypo is less. When a person does not have any inhibitions, when a person talks too much, laughs too much, like the picture that is displayed here, the lady is just laughing so much because she feels that she's captured the whole world, the universe. She's capable of doing everything. You ask her anything, she has an answer for every question. So with such people, you cannot argue, you cannot do anything. You have to just leave them like that and take them for help to an expert, and he or she will be put on medication and they'll come to normal. It's not a big deal. But what I am insisting is that when you come across such people, you please take them to an expert and seek help, without which they'll be nowhere. Bipolar disorder and the major depression disorder, these things need a lot of patience to take care of these people. It's not easy to take care of such people at home. Some of them may need hospitalization for days or months. If you can manage them at home, well and good, but you should have immense patience, empathy, sympathy, all, and a kind-hearted attitude. Without this, it becomes an impossibility to keep them at home and treat them. It's always better you send them to rehabilitation centers, either for daycare or put them in rehabilitation centers where they learn something. So when they learn something, when they feel that, okay, I'm learning this and I can do this, that happiness comes from within. And they'll be able to come out of this with ease. Of course, medicines are a must for such severe symptoms. But apart from that, they need to take care of other aspects like some hobby, or some outing. They can go out on a family outing, or talking to friends. Have a lot of friends and talk to them. Apart from this, there's another major thing that we come across in people with mood disorders. Sexual dysfunction is a major thing that people don't, go to a doctor for a consultation because they think that it will become normal. When they are in a case of mania, they could have a very high libido, and when they are in depression, they could have almost zero libido. So when they are taken to the hospital for a consultation, all these things have to be told to the expert. Whatever you know, just tell your doctor about it, that you're facing these problems, and they will take care of it and help you get over this disease. We at Prakruthi get a lot of cases with bipolar disorder and major depressive disorders. We have a daycare facility for such people. They come here in the morning and stay up to evening. They're given a lot of training here so that they can come out of their problems at the earliest possible. They are even trained with vocational skills so that they can stand on their feet and earn their living. So if you have any cases, you can send them to Prakruthi safely, and we are there to help them. Thank you so much.